Hello, this is Christy Snyder, and I'm going to be talking with you about the concept of collaboration. Collaboration is so important to the nursing profession. It provides good communication with other members of the healthcare team, as well as the patient and the patient family and our fellow coworkers. Here are the student learning outcomes for the concept of collaboration, and you'll find these on the unit outlines. As we go through, we should cover them. And then here are the exemplars that we will use for the concept of collaboration. We're going to talk about long-term care patients, care planning, and quality improvement, near miss, and sentinel events. So, what is collaboration? And why is it so important to nursing? What's your idea of collaboration? Just think about that. Who do you collaborate with on a daily basis when you're at work? And what might be some attributes of a good collaborator? This is the definition that Mary Grimes School of Nursing has chosen for collaboration, and it's found in the Giddens book. It just talks about partnerships and helping the patient achieve the best possible outcome, and that includes the patient, the family, or the community, depending on where we're working at. So what are attributes and criteria that are required for good interactive collaboration? We have to think about values and ethics, our own as well as maybe the values and ethics of others on the collaborative team. This involves respect and trust and appreciation for diversity in patients, healthcare providers, and ancillary support staff. It's also appreciation for the various individuals' culture and differences as they perform their role. It's also appreciation for cooperative work and contributions to the good of the patient, their family, and nursing in general. When we talk about roles and responsibilities, this involves appreciation and understanding of each individual's role and the responsibility to the healthcare team. We have to appreciate those roles and responsibilities within the legal boundaries and limits of the competent professional. And we have to respect the knowledge that they bring to the collaborative team. Communication is the core of collaboration, as I've said. Communication is such a foundational piece of our nursing collaboration. It's the core of collaboration, and communication can encompass verbal and nonverbal forms, and health and consideration of health literacy, technology, language, listening, and conflict resolution. I hope you've watched the communication video PowerPoint presentation. If you have not, I would recommend that you would stop this and then go and watch the communication PowerPoint, because that will help the understanding how much it works in collaboration better. When we talk about the teamwork in the team, it's evidence-based practice. It involves patient-centeredness. It involves care coordination. It's shared problem solving, shared accountability, shared decision-making, leadership, and the ability to evaluate effectiveness of care. So with each concept, there are scopes and categories. We have to talk about intradisciplinary versus interdisciplinary. The first one is nurse to patient. Remember that the patient and their families are part of the healthcare team, and they should be involved in decision making. Health promotion and disease prevention behaviors will only come to fruition if we involve the person that we want to have change their behaviors. We also need to involve them in treatment strategies and options, lifestyle changes, and end-of-life decision making. This started with Florence Nightingale. So it's really important that as nurses, we involve the patient in their care and learning how to care for themselves. And it's also important to include their family, because depending on whether they're pediatrics or maybe an elderly or maybe someone who has a chronic disease process, the family member may be the caretaker. When we talk about nurse to nurse, that is intra-professional, intradiscipline. That's within the discipline, so nurse to nurse. We're going to talk about mentoring of each other and shared governance. When we talk about interprofessional or interdisciplinary, that's outside of the profession. It's multiple professions coming together. It's that formation of partnership between a team of health providers, patients, and families in a participatory, collaborative, and coordinated approach to sharing decision-making of health and social issues. When we talk about interorganizational, that's talking about multiple organizations coming together to pool resources between them. Coalitions or consortiums. So they can get better buying power if they all come together in a consortium. Sometimes you will see them come together, the smaller hospitals join with larger hospitals to provide their employees with better health care insurance. So that is interorganizational. We have to use the nursing process to determine our collaborative team effort. And think about, if we're planning outcomes, what part can the patient or family be involved in? And how's that going to help create better patient outcomes? Like I said, if the patient and or family or caretakers are involved in the treatment plan and the options, and especially the dismissal options, then they will better adhere to a good treatment plan and have better outcomes. Remember that nursing is not an individual profession. This is definitely a team sport. So it's really important that you start collaborating with your fellow work members and your fellow nurses, so that you can have someone to go to if you are uncertain about something, or you need clarification. You have a patient that you don't think is acting just right, but you can't put your finger on it, or you hear breath sounds that you're not quite sure of what you're hearing. So you need to have people that you can rely on. When we talk about mentoring, that's a partnership between the novice and the expert nurse. That's that beginning nurse and an expert nurse. It could be a partnership between a mid nurse. We may not have that expert nurse to go to, but we need to have somebody that we can rely on. Mentoring can be orientation, or it can just be after the orientation period is over, it can just be someone that the novice nurse depends on to go to with questions and concerns. So collaboration is in mentoring and orientation. Magnet hospitals use shared governance to empower the nursing staff to have more of a say in policies and help provide better patient outcomes. So what professional disciplines might be involved in interprofessional collaboration in long-term care or in the hospital setting? You might think about the healthcare provider. You might think about the pharmacist. You might think about respiratory therapy or occupational therapy, physical therapy. These are important people that are going to bring their knowledge to the table to help with good patient outcomes. But we can't forget our patient and their families. So what significant information would you need to report to other disciplines? Think about that. If you're working on a collaborative interprofessional team that is working on getting a total knee patient ready to go home, what are things that we as nurses need to bring to that bring to that collaboration about that patient that will help them have a good patient outcome? And remember, we have to respect each person on that collaborative team's knowledge and their culture and their ethics and their values. They are going to expect you to be knowledgeable as well. So how can you be a good resource person to other staff? Think about that. What kind of a role can you play for a new novice nurse or that student nurse who is on your unit? As I've talked about so much, communication is key to successful patient outcomes. Poor communication between nurses and other interdisciplinary team members has been highly cited for errors in patient care. That is why the Joint Commission mandates some kind of reporting tool, an ISBAR, bedside report, some kind of a handoff report, whether it's to the next shift of nurses, to another department, or to the healthcare provider. Communication is vital to good patient care and good patient outcomes. So these are team members that can be on a collaborative team. If we talk about case managers, nurses and social workers are often the case manager. The nurse will oversee and coordinate the necessary needs of the patient during the stay and especially discharge planning. And don't forget that discharge planning starts at admission. So it's really important as nurses that we get involved with thinking about the end game. Where is our patient going to be dismissed to? What kind of patient education are they going to need? Are we going to need to bring in the social worker? Do we need to bring in pharmacy or respiratory therapy, physical therapy, occupational therapy? So we talked about interorganizational with coalitions and consortiums that can help lower costs and provide education for employees, the community, etc. It's also going to help lower healthcare costs for our patients with the consortiums because the products will be at a better cost for the hospital. Here's some theoretical links. I'm not going to talk about them extensively. Just know that there are several theoretical links. Kim's theory of collaborative decision making is a patient-nurse model of collaboration. There's also an interprofessional education collaborative model, and it talks about the attributes that this is required. I would like to point to Gardner's 10 Lessons of Collaboration. I don't believe you have the Freiberg book, but these are all listed here. And the first one is know thyself. You have to know who you are, what your values are, what you value, and what your ethics are to be a good a participating member of the collaborative team. You're going to learn how to value and manage diversity. You have to be good with constructive conflict resolution skills. And you have to know how to create win-win situations for the patient and the family. So read these over and think about these. So collaboration is addressed by the American Nurses Association Code of Ethics for Nurses that healthcare facilities and some state boards of nursing use in their scopes of practice. Collaboration is so important that it's addressed to us by the American Nurses Association. And then we have to think about the complexity of healthcare delivery system and the multidisciplinary approach that includes educators, researchers, and administrators. When we think about collaboration in practice, we think about the interdisciplinary teams. Quality and Safety Education in Nursing initiative anticipates that collaboration is going to have a huge impact on positive patient outcomes and improve quality of care. I'm sure through this COVID pandemic that there were some collaborative teams that had some very hard decisions to make. And sometimes it's not easy to make decisions that are going to have positive patient outcomes. But hopefully now we've had a little more light on the COVID pandemic, we can institute better collaborative teams, and they can provide better patient outcomes for patients. So what is case management? It's a model that integrates healthcare services for individuals and groups. It involves a multidisciplinary team. It assumes collaborative responsibility for assessing needs, planning, and coordinating, as well as implementing and evaluating care for groups of clients. It starts from pre-admission to discharge or transfer and recuperation. The case manager coordinates appointments for health disciplines in a home health environment so that there's not multiple visits from the same type of healthcare discipline. So who can be the case manager? Usually nurses or social workers or another appropriate professional. If it's a patient with COPD, it might be the respiratory therapist. Sometimes they may be called, case managers may be called discharge planners. We see case managers in long-term care. This is a good example of where they're used. But you will see them in bigger hospitals on units. Requirements for quality case manager. I have put a handout in Unit 1 resources, and it's called Requirements for Quality Case Management. Number 1 is collaboration of all members of the healthcare team be involved. But there are requirements for a case manager. And so you might want to pull up that handout and take a look at it. Again, on the handout, these are listed on the handout. It just talks about the essential elements for success, that collaborative practice teams, good management system, a qualified nurse case manager, support by key members of the organization, and all professionals on the collaborative team must be equal. So these are really important, the 5 C's. You need to know these. These are important. We have to have a common goal in our collaboration, and it's for patient-centered and patient outcomes as directed. Each member needs to be committed. Each member must have knowledge, skills, and behaviors. Everyone on the team expects the person in their profession to be competent in their role. Communication, again, so vital. And then coordination, being able to work together effectively and efficiently. We talked a little bit about Sentinel events. Sentinel events, you can find this on page 625 of On the Point in the book Leadership Roles and Management Functions in Nursing. Sentinel events are unexpected occurrences that involve patient death or serious physical or psychological injury or the risk thereof. So when we talk about serious injury, loss of limb or loss of function, these events have to be reported and investigated immediately with some kind of a response so that we recognize the cause and we can figure out how to prevent it again. This is where a good root cause analysis should take place so that we can determine the cause. We think about wrong site surgery. This is probably a big Sentinel event that needs to be reported. The SCIP project probably started in 2005 or 2006, the surgery care improvement project, where the patient and the surgeon, if it was the surgical site was on extremities or the ears or some eyes, that the physician and the patient both had to mark the site so that wrong site surgery could stop. So it still surprises me today, 15 years later, that we're still having wrong site surgeries. If there's an unexpected death, say in surgery, or a patient who's dismissed to home and then dies that day, that's a sentinel event. So there are a lot of different sentinel events, and there's some listed on the slide. But the main thing about sentinel events is that we need to recognize them and report them. So some interrelated concepts for collaboration is we always need to be thinking of patient safety. The Institute of Medicine identifies effectively working together as an important professional competency to keep our patients safe. And the Joint Commission has cited breakdown in communication. Again, here we go with communication among team members as the primary factor in sentinel events. So it's really important that patient safety, communication be number one concepts for interrelated. We also look at developing that teamwork culture. And strong teamwork is going to help promote job retention. Your nurses are going to be happier. They're not going to resign as fast. There's improved perceptions between the RN and the healthcare provider, as well as improved communication skills. So these are some interrelated concepts. This is the end of the collaboration PowerPoint. Again, if you have questions, please contact me. I gave you, I'll be in my office through the month of June, so you can come see me in office 303. You can send me a question at ksnyder@neosho.edu, or you can call me on my office phone. Thank you so much,